Hello and welcome to IDFC First Bank presents Leaders of Tomorrow Season 11. I'm Sunanda Jayaseelan. Today, a very special and fascinating conversation with one of the hottest entrepreneurs in the pharma space today. I'm speaking with none other than Namita Thapar. She spoke to us on the sidelines of Ladies Who Lead, a members-only platform for women entrepreneurs. This is Namita's first interview in a very, very long time, so it's our honor and privilege that she spoke to us. In this freewheeling conversation, we discussed the opportunities and challenges for the pharma space. She talked to me about innovation, R&D, as well as PPP when it comes to the pharma space. Listen.
In a world where healthcare knows no borders, India's pharmaceutical sector emerges as a global powerhouse, supplying life-saving medications to over 200 countries. From generic drugs to innovative treatments, the country's pharmaceutical sector has become a beacon of hope for patients around the globe. Valued at $37 billion, the sector has experienced remarkable growth over the past decades, fueled by the country's skilled workforce, strong infrastructure, and commitment to quality. Today, we are not only manufacturing generic drugs, but also investing heavily in research and development, leading to the discovery of breakthrough treatments. Expected to grow at a CAGR of 10% in the next few years, India's pharmaceutical sector will indubitably shape the global healthcare landscape, combining innovation, affordability, and compassion to improve the lives of people worldwide. Joining us today is a multi-hyphenate leader, champion of the Indian pharma industry, investor, author, and executive director of Emcure Pharmaceuticals, Namita Thapar, discussing all things pharma, from the opportunities for entrepreneurs in the country to challenges and the role of technology in advancing the sector on a global scale.
Namita.
Hi, Sunanda.
An author, a reality TV star, a pharma giant, and also I understand now a master of many, many languages.
Trying.
What other feathers in your cap are you looking at adding?
As of now,
apart from, of course, from the fact that you're a mom and you've raised
I think,
two
Sunanda,
children.
honestly, I'm at that point where I just am doing too many things. So I'm taking a nice break after season 2, enjoying finding extraordinary joy in my boring, ordinary routine. So as of now, that's good enough.
Fantastic. Let's talk about the pharma space.
Sure.
And there's just so much that's been happening, both at Emcure, but also in the broader pharma industry. And I want to set the context for our entrepreneurs by saying, these are the opportunities as Namita Thapar sees it.
Super. So I look at the domestic business of Emcure Pharma. So let me just talk a little bit about both the opportunities as well as the challenges in domestic pharma. Opportunities are very obvious. We have a very large population. Lifestyles are getting worse by the day. Unfortunately, people are getting more sick by the day. In a good sense, after COVID, the average incomes are rising, especially in the interiors. But a big fact is that modern medicine only reaches a very small percentage of people in India. And that's where the opportunity is. In terms of challenges in my business, the top 3 that come to mind, which have really been energy guzzlers and a big drain on credibility of pharma industry in general, are number 1, spurious drugs, counterfeit drugs. This is something very serious. It causes massive adverse reactions and harm to patients. Like I said, it's a big blow to pharma credibility. And currently the central state governments, the way the government and the sort of health administration is distributed, it's all disjointed. So it's extremely difficult to really get closure on these spurious drugs. The second issue is generics. Under the garb of selling at really low prices, the quality controls are not in check. Again, this can cause a massive issue in terms of patient safety. And then the third issue that we spoke about earlier is rising raw material prices. On one end, you have NLEM, which keeps regulating new drugs every quarter. And pharma is just taken by surprise at the new entrants. And on the other end, you have these massive rising raw material prices, and the two together are a double whammy on our GCs. To a large extent, this really comes in the way of our ability to invest in research and development. So I would say these are the top three challenges facing me as somebody leading the domestic industry. But it's a fascinating business, a lot to do, and exciting to be part of this.
You were saying R&D, I'll just come back to that, but something that you said is very interesting, that the number of diseases perhaps that we're seeing, especially amongst urban Indians, is increasing. And you are someone who speaks very passionately about disseminating information on staying healthy, on how to have a healthier lifestyle. Do you see more of that information and awareness, especially post the pandemic?
It's one of my favorite questions. I can go on and on. You know, I run a YouTube channel, Uncondition Yourself with Namita, 32 episodes just for this reason, because awareness is a massive gap in our country. 50% Indian women are anemic, most don't even know about it. Simple blood test, but they don't do it because they don't prioritize their health. Having said that, lifestyle is a big issue. I remember on Shark Tank season 2, there was this lady who came in, was talking about a diet venture, but on her banner it said no exercise. And it really rattled me, and that reel pretty much went viral, where I kept telling her, please stop misguiding India, because we've become the diabetes capital. Hypertension is a serious issue, and she's going around telling people don't exercise. So I think there are a lot of lifestyle issues in our country, a lot of these myths and taboos. Coming on taboos, you know, I use television as a platform to also talk about my 2 IVF procedures. I spoke about my tryst with mental health. I've written about it in my book as well. Post-pandemic, we've seen a 25% rise in mental health issues, especially with the youth. If this is not tackled at the right time, by removing these taboos about going and talking to a counselor, we're going to be in serious trouble, because Gen Next is not really going to be able to deal with the complexities and the challenges as they get into the working space.
You started this interview by saying that modern medicine is not really reaching the hinterland, at least as much as it needs to. How are companies like yourself and entrepreneurs and leaders like yourself really working to ensure that changes? We're also seeing a lot more awareness. India is the land of Ayurveda, but unfortunately, perhaps in urban India, that awareness was not there. We're seeing that perhaps now coming back post the pandemic.
We are, but a lot of education again is needed. So, you know, this is where I'd like to talk about startups. We saw such fascinating startups at Shark Tank, and even otherwise as an investor. Technology can play a very big role, Sunanda. So technology is one way that both the 3 A's, which are the biggest gap: awareness, access, and affordability. There are a lot of startups in the space that are coming up with very good solutions to really work towards the interiors. So one of the startups I've invested in is a pocket-sized ECG device. And Emcure has this hub and spoke model, and we're using this ECG device with all our spoke doctors who are in the interiors to make sure that patient lives are not lost. So startups is one area, especially in healthcare, where technology can play a big role in meeting these gaps, and which is the reason why I'm always a big advocate of the fact that these startups need a lot more funding and a lot more mentorship.
Let's come back to the R&D question. India was put on the global map from a medical perspective thanks to its COVID vaccinations and the scale and the speed at which we were able to do that. But companies like Emcure have been doing R&D for a very long time now. How do you ensure, for the entrepreneurs who are watching this interview, who are from the pharma space, what's your advice to them to ensure that we see more such innovation really coming out of this space?
So firstly, Sunanda, let's be very realistic here. When we talk about R&D and innovation, let me put a couple of numbers in front of you. Pfizer is a $100 billion company. It puts about 11% of its top line in R&D. You're talking about $11 billion going just by one company in research. Most large Indian companies are $1 to $2 billion companies. I'm talking about the top companies. No matter what percentage we put into R&D, that's not enough. So you see just the sheer scale and muscle power that a multinational or a global company like Pfizer has compared to, say, an Emcure. But having said that, the 2 areas where I'm very optimistic when it comes to innovation within pharma, and the good news is that vaccines is one area we can do a lot in India. The other area where Indian pharma can have an advantage is biologics, especially in rare diseases. So I think at some point Indian pharma needs to move up the value chain, and that can only happen with the right investment in R&D, especially these two areas, vaccines and biologics. I'm personally very optimistic about. I mean, let me just give you a couple of examples about MCure. Today, the reason we are a large company, in spite of being such a late entrant in the Indian domestic market, is because we came up with chirality, which clicked. That made our brands really big. We came up with first mover advantage in molecules like ferrous ascorbate, as well as ferrous carboxymaltose, and we are the leading player in the iron segment for anemia. This is all because we had innovation on our side. So today, if companies really want to build their brands and make them massive, innovation is the only way.
Fantastic. I'll take a quick break on that note. Much more on the other side. Do stay tuned. We're back in just a moment. Welcome back. You're with us here on IDFC First Bank Presents Leaders of Tomorrow, Season 11. Namita, just going back to MCure and to the business, we've been speaking a lot on PLI for manufacturing. I haven't had the chance to discuss PLI with a pharma company such as yours, and also APIs, and really some of the challenges or the problems being faced by pharma companies.
Sunanda, this is a great question, and to be honest, the PLI is a welcome step in the right direction, but it's just a tip of the iceberg. I mean, think about the challenges we face. Let me give you my example. I told you we're dominant in the iron segment. For that, we need vitamin C, right? This requires fermentation, and where fermentation is concerned, China has such massive capacities that there is no way, even with a PLI, that I can compete for vitamin C locally. So there are a lot of molecules still where there isn't a level playing field. And for there to be one, it's going to need a lot more effort and a lot more time for us to get there. So this is a very complex issue which needs a lot more investment and time from Indian entrepreneurs as well as the government.
Great. Do you think also technology perhaps is going, you're seeing a lot more innovation where technology is involved?
Absolutely.
The pharmacies of the world, etc.
Absolutely. I mean, there's technology everywhere. When you talk about another investment of mine on Shark Tank, Janitri, which is monitoring, the fetal, maternal mortality it's trying to bring down. It's all about their AI app that enables doctors to monitor high-risk pregnancies. When you talk about PharmEasy, that's again online pharmacies. Telemedicine. Unfortunately, is not taken off to the extent it should, but that's a massive area that can really bridge the gap in the interiors like we spoke about. Technology in clinical trials, technology in precision, customized medication. I mean, technology can be used in so many areas, even in our manufacturing. We're bringing in so much technology to make the processes more robust. So Sunanda, when you talk about technology in healthcare, it can take a whole different talk between you and me. And this is an area I personally feel very passionate about, very optimistic about, but then again, a lot more investment is needed.
So since you were talking about R&D, I just want to go back to that. And you're talking about the limited budgets that Indian companies have, even at the top. Would PPPs go some way towards solving that, perhaps?
A great question, Sunanda. PPPs definitely would go a long way. So if you're talking about a partnership between government, pharma, academia, definitely in research, that would go a very long way. If there's an integrated approach, rather than all of us working in silos. The other big area is we have a massive shortage of doctors, nurses, psychiatrists, hospital beds. You name it, I can just rattle off statistics to you. There is a big demand-supply gap here. This is where, again, PPP can play a very big role. Startups is another area. If we really have an integrated approach And a lot of times, I'm part of these discussions. But the problem, Sunanda, if we want to be really honest, is people spend a lot of time discussing, making the white paper, but it's all about execution.
Yeah.
Discussion is 1% of the job.
Yeah.
99% is to rigorously execute and get it done in a timely and cost-effective manner, and that's lacking. So there are PPP conversations, but the execution is not as robust as it needs to be.
Okay. I want to talk about your book and a few interesting things that I picked up from your book. And first
thank
and foremost,
you for reading it.
Not at all, and thank you for the copy. And you're talking about sharks and dolphins, saying leaders need to be both aggressive but also empathetic and have empathy. Why is that crucial? And is it something that is, awareness around empathy becoming more amongst leaders post the pandemic, you feel?
It's funny, there's so many stereotypes. Even now when I talk to my friends, especially male friends, they're almost shy or embarrassed to show their softer side. And I think that's such a big loss for them as leaders, or even for a lot of women who feel they have to be extra aggressive to fit in a man's world. And I think opposites can coexist if you really know how to balance them well. My personal example, there are moments both on the show as a mother, as a businesswoman, where I have to bring my sharky side out. I have to be absolutely firm and assertive and, say, this is it.
Yeah.
There are times I need to bring out the empathy. So it really depends on the situation, but hearts are won and troops are rallied and teams are built on the right balance.
Sure. You also have some lessons, if I can call it, or tips really for women entrepreneurs specifically in your book. Just run us through a few of those.
I always say women are great at time management but terrible at guilt management. I think that's the one disease that women need to get rid of. We spoke about how women need to ask for more help. We're almost afraid to ask people around for help as if that's going to make us less worthy of a mother. And I think that's okay, just ask for help. Also, we're too busy posturing and trying to show our perfections. I think the beauty is when we show our imperfections. That's what makes us more real, more relatable, and gives strength to the others and makes them feel like they're not lonely in their journey. So a lot of issues that we personally need to work on as women in terms of self-limiting behavior. I think that's important. Learning to say no, that's a big one.
Absolutely. Yeah.
I can go on and on.
You're saying time management. I think you should write an entire book just on how you manage your time. You're speaking with us today. You run MCure. You're also, as part of Ladies Who Lead, you're addressing a group of female entrepreneurs in just a short while from now. How do you manage to juggle it all? Give us some insights and tips.
I have two secrets that I'm going to let you in on. The first secret is hire people way smarter than you and delegate and empower them and then watch the magic. My second bigger secret is I remember some news article, I think it was 2 years back, where I said, I really want to work on meditation, but I'm so high energy that I'm not able to do it. And I can honestly say, Sunanda, I've been reading so much and practicing so much that I've gotten way better at it. And it's still a myth. I meet my friends and they say, oh, meditation, buddhe log karte hai. Like that's for the retired people. And they don't realize that if you really practice silence and awareness and observing without judgment, it can make you twice as productive, twice as focused, and a much happier person. So why wouldn't you do that much earlier in life than waiting when you have more gray hair? So I learned it very late, but I urge all our viewers to really start working on finding this silence and this empty cup in their minds sooner rather than later. That's the secret.
Amazing. The overarching theme that we have on the Leaders of Tomorrow this season, Namita, is Ideas for New India. So if I could ask you to, and we've gone over some of the ideas for the pharma space, but from a broader perspective, what do you feel are going to be those 2-3 ideas that you want to call out for our entrepreneurs to say, these are going to be game changers?
I think the biggest one is healthcare. Even now, the entrepreneurs, the startups, the founders in healthcare are just not enough. And the ones we come across, they don't have the data, the trials, the numbers, the credibility that it needs to scale. So I'm a big advocate of startups, technology, and really putting our money behind it. If we work on that, that can be the next big wave in a country like India, where I said the 3 A's.
Yeah.
Every big challenge is also a big opportunity. So I would double down and put all my chips on healthcare. They call me pharma for a reason.
Mother of pharma.
Yeah.
Completely out of time on tonight's show. If you have any feedback for us, do let us know. Our details on your screens as we speak. Thanks for watching. Have a good night.